Good evening and welcome to Doctors on Call. I'm Dr. Peter Nalen, professor and head of the Department of Family Medicine and Biobehavioral Health at the University of Minnesota Medical School, Duluth campus. I'm your host for our program tonight on eye issues, cataracts, glaucoma, and macular degeneration. The success of this program is very dependent on you, the viewer, so please call in your questions tonight or send them in ahead of time to our email address, ask@pbsnorth.org. The telephone numbers can be found at the bottom of your screen. Our panelists this evening include Dr. Charlie Ahrens, an ophthalmologist with Aspirus St. Luke's, Dr. Elizabeth Aponte, a glaucoma specialist with LifeView Glaucoma Center, and Dr. Lisa Graham, an ophthalmologist with Relf Eye Care Specialists. Our medical students answering the phones tonight are Nathan Johnson from Grand Rapids, Minnesota, Ethan Lorsung from Sartell, Minnesota, and Danielle Santos from Smithtown, New York. And now on to tonight's program, eye issues, cataracts, glaucoma, and macular degeneration. And the questions are already coming in. So, Dr. Ahrens, what is the difference between cataracts and floaters?
So this is actually a pretty common question that we get, especially if we're dealing with cataract surgery, because people are always asking, well, is the cataract surgery going to get rid of our floaters? So cataracts is a hardening of the lens, and I tell my patients, everybody gets cataracts. If you live long enough, we'll be talking about cataract surgery. The lens of the eye is going to get harder and harder and more dense as we age. And so once that gets hard enough and dense enough, it's going to start affecting the vision. And then that's when we remove the lens and replace it with an artificial one. And that's our cataract surgery. Floaters, as we age, the gel in the back of the eye, which is behind the lens, will actually start to liquefy a little bit, and it'll contract and pull forward and pull and separate off of the back of the retina, or off the back of the eye and off the retina. And when that happens, it kind of crinkles up like a clear sheet of cellophane. So it'll crinkle up and it'll kind of waft in and out and float, and that's what you're seeing and picking up as the floaters. So a little bit different area of the eye and a different mechanism for it forming.
Thank you. Dr. Aponte, what are first-line treatments for glaucoma?
Yeah, so we now know that patients who have the SLT laser, the selective laser trabeculoplasty, have a lower risk of progression for glaucoma. However, because of problems with access, for many people, they are still placed on eye drops as a primary treatment. But it is recommended to do an SLT as the primary treatment, which means before being placed on eye drops.
Thank you. Dr. Graham, what are common symptoms of patients with cataracts?
Just kind of a gradual change in vision. Sometimes the prescription changes more quickly as you're developing cataracts. They can interfere with vision in a multitude of ways, just plain blurriness. It can interfere with color perception, and a lot of people complain about glare. So glare with streetlights and headlights at night, even sometimes glare on a bright sunny day can interfere with vision.
Thank you. And Dr. Ahrens, a caller asks, I've woken up in the middle of the night with the sensation of being poked in the eye. What might this be, and is it concerning?
That's a good question. It could be a couple of different things. The most common thing that I would say comes to mind would be dry eyes. Especially at night, if you're somebody who tends to sleep with their eyes open a little bit, that can cause more evaporative forces and cause a little bit of dry eyes. One thing that we as providers should always think of if you're waking up in the middle of the night or waking up first thing in the morning would be something called recurrent erosions, where the top layer of the cornea will kind of stick to the back surface of the eyelid, and if there's not a good attachment to the underlying layers, it might, as you either go through REM sleep where your eye's moving a little bit, or when you wake up and you open your eyes, it can actually peel part of that cornea off. And so there are little subtle changes that we can see on our exam to identify that. So for this person, if it's really bothersome for them or if it's affecting their vision, I'd probably say, let's take a look at it and kind of evaluate it.
Have the eyes examined in the office.
Yep.
Thank you. Dr. Aponte, how is it that the laser actually treats the glaucoma?
Yeah, so the truth is it's a mystery. There are different thoughts. So one thought is that there is, for the mechanical action to the meshwork, which allows the trabecular meshwork or the drainage of the eye to be more flexible, to be able to actually drain more fluid. There's also a thought that the laser can release some cytokines in the eye, which can cause the trabecular meshwork to change shape and to increase space for the drainage. We also think that the laser itself can create the inflammation inside the eye. When the eye has when the eye is inflamed, sometimes the eye can produce less fluid as well, and that can also change the meshwork. But although we don't know exactly how it works, it's highly effective.
Thank you. Dr. Graham, another caller notices feeling tired when wearing contacts. What might that be?
The most common reason I would think would be dry eyes. So dry eyes can happen for a variety of reasons. Evaporation, which is prominent especially in the winter months when the air is drier. As we age, our eyes get drier, and sometimes contacts aren't as tolerable. If you're wearing them for a long duration, they can irritate the eyes, and the eyes can become drier. It's good to give your eyes breaks when you're wearing contacts. A lot of advertising makes it seem like you can wear them 24 hours a day, 7 days a week, but most of us do not recommend that. It's good to give your eyes breaks so they can sort of recover from the dryness of wearing contacts and the irritation of wearing contacts.
Thank you. Dr. Ahrens, caller has noticed an increased difficulty driving at night regarding vision. What might be explaining that?
Well, the two most common things we kind of already hit on twice, actually. So the number, well, depending on age and what their eye exam looks like, and if anyone's struggling with the glare, nighttime halos, we always think about cataracts, especially as we age. Dry eyes can cause very similar symptoms to cataracts with the glare and the halos off headlights. So especially right now, I'm assuming you guys are noticing this in your clinics too, but we're seeing an influx of dry eyes right now over the last couple of months because of the change in the weather. We live in northern Minnesota, arid conditions. Those are, I would say, are the two most common causes. There's other causes that can change those, but they're a lot less common, and you wouldn't think of those until you're doing your exam and kind of see if there's changes in the cornea as well. But obviously, much less common. The two top ones would be cataract and dry eyes.
Thank you. Dr. Aponte, a caller wants to know what they might be able to do to slow the progression of their glaucoma.
Yeah, so obviously they have to see their eye doctor, and based on their eye pressures, they might have some recommendations, whether it's laser, eye drops, some eye surgeries. Patients often want to know what things they can do at home to help to actually slow down the progression. And one thing that we do know is just like for the brain, it's good to exercise. So if you can try to exercise 20 minutes 4 days a week, that can slow down the progression of glaucoma.
Thank you. And Dr. Graham, for you, this question, how does screen time affect one's eyes?
In a variety of ways. It depends on your age. I think for kids, we know that progressive changes in vision, especially nearsightedness, can occur when there's a lot of screen time. It's really good for kids to be outside and focusing at a distance. So your grandmother's old recommendation, don't sit too close to the TV and go outside and play, is probably really true. As we get older, we've already mentioned dry eyes a number of times, but screen time causes your eyes to dry out because you don't blink as often when you're staring at something. You blink probably 30% less, and so you're not coating your eyes with tears as often, and they'll dry out more readily. There's also various reports on light exposure from screens affecting your sleep patterns, and some of those are true. They're not wives' tales.
Thank you. And Dr. Ahrens, a caller asks about the new lenses for cataract surgery, and are they worth the cost?
That depends. So we were actually just talking about this backstage, and so there's newer technologies coming out all the time. It's kind of fun to be in this occupation, because right now all these companies are competing against everybody trying to come out with the new advancements, and so it's really fun being able to offer these to patients. And so it really depends on the individual and what they're expecting after cataract surgery. So for some people, if they have already significant medical issues with their eyes, they might be best suited for our standard lenses, which give the best quality of vision, but they might have to wear glasses. The majority of the specialty lenses that we're using now are geared towards getting rid of the glasses and becoming as spectacle independent as we possibly can be. And so that can be anywhere from toric lenses correcting for astigmatism, multifocal lenses, kind of runs the gamut. And so it's really up to the individual patient. These are the conversations I have. It's up to the individual patient, and is it worth it to them for the cost to be able to be glasses free, and what their activities are in regards to that.
Thank you. Dr. Aponte, would you please describe the recovery and your advice to patients after laser surgery?
For the glaucoma lasers, or
yes, thank you.
For the glaucoma ones, they can go back to their regular activities on the same day. So the procedure itself takes about 5 minutes. We ask our patients to wait in the office for 30 minutes so we can check their eye pressures, and then they can pretty much go back to regular life on the same day, so no restrictions.
Thank you. And Dr. Graham, how about for cataract surgery, the recovery and your advice to patients after that surgery?
With cataract surgery, they've been sedated that day, so it's probably good to go home and relax that day. I've had people go back to work on the same day. We don't recommend it, but it's possible. They may be a little blurry on the day of surgery in the operative eye. They will still be dilated for most of that day and into the next day for most patients, so that can kind of get in the way of your vision a bit. There are some minor activity restrictions. We tell them nothing strenuous and no heavy lifting for a week after surgery, but most people, they can still do their normal activities. They are on eye drops for the most part, especially the first week after surgery, or most frequently the first week after surgery, tapering over the following weeks. So there's not a lot of restrictions. Most people are seeing well and functioning well the next day.
Thank you. Dr. Ahrens, what is the distinction between dry macular degeneration and wet macular degeneration?
Good question that we get every day in the clinic. So dry macular degeneration, what I tell patients is it's about 90% of the people and about 10% of the problems. Wet macular degeneration is about 10% of the people and 90% of our problems. With dry macular degeneration, you get an atrophy or a thinning out of the retinal cells that sense light and the underlying layer that provides nutrition for it. And it's just a slow, gradual progression. Whereas wet macular degeneration, we get abnormal blood vessel growth, leaking from underneath blood vessels through that layer below the retina, which then causes leaking, scarring inside the retina. And that can lead to more abrupt vision loss and more significant vision loss when that happens.
Thank you. Dr. Aponte, this question is about light therapy, and the caller wants to know, what is the effectiveness of using red light therapy for dry AMD?
I'm not sure about the effectiveness of that, but we do have treatment that are proven. So for those patients, you can do, for the injections, for the anti-VEGF, and those are highly effective to treat the wet macular degeneration.
Thank you. Dr. Graham, what might happen if cataract surgery fails, and what are a patient's options?
It's quite rare for cataract surgery to fail. There can be perhaps complications that might prevent us from fully completing the cataract surgery, like perhaps if something goes wrong during the surgery, we might not implant the lens, the intraocular lens implant. We might hold off and do it later. Otherwise, cataract surgery is really, really successful. And even when there are complications, we tend to be able to rehabilitate the eye later.
Thank you. Dr. Ahrens, a 65-year-old caller says her eyes are watering all the time. Isn't this the opposite of dry eyes? What might be going on?
Paradoxically, yes, but we have a reflex loop that's designed to protect our eyes. So if our eyes get really, really dried out, it's going to reflexively tear to try and flood the eye and protect it. And so when we get really dried out, we reflexively tear. However, those tears aren't our normal basal tear secretion. So they're not geared to like stick to the eye and give us long-term lubrication. It's meant to flood the eye, clear out whatever's, whatever might be in there, whatever is irritating it. There are other mechanisms for tearing though as well. So if, say, your eyelid is not approximated to your eye correctly, the tear drainage might not be accessing the tear pool to drain effectively. So occasionally we'll have to do eyelid surgery to tighten the eyelid and get that back to operating the way it should be. And you can also have blockages in the drainage system, which, our face is one giant tube system. And if there's a blockage in the drainage system, we might have to open that up to alleviate some of the tearing problems as well. So it's kind of when we evaluate patients, it's finding out, well, which of those three mechanisms is at play, and then providing treatment to that.
Thank you. Dr. Aponte, a caller from Duluth asks, after being told by their doctor that they have cataracts, but we don't need to fix it right away, what might be going on?
Yeah. So I usually explain that for the cataracts, they're some birthday gifts. So we will all get them if we get older. But just like for the wrinkles, just because it's there, it doesn't mean that it needs to be basically removed. And so for the cataracts, it's part of the natural process for aging. Surgery has risk, so we only want to remove the cataracts if they start to cause symptoms, which include some glare when patients basically drive at night, some blurry vision, trouble to read. So if she starts having those problems, then at that time, it's worth the risk of surgery.
Thank you. Dr. Graham, an interesting question. What is a light adjustable lens?
That's one of those newer elective lens implants. It is very interesting. The benefit of it is that we can implant it like any other lens during cataract surgery, but we have an opportunity to fine-tune the power of that lens after surgery. So once the eye has healed and your prescription has stabilized, we can then do light treatments, which is why it's called the light adjustable lens, to change the shape of that lens implant within the eye and change the prescription that the patient has to minimize their glasses prescription. So it's an elective lens implant that I think we can get as close to zero prescription as humanly possible after cataract surgery.
Thank you. Dr. Ahrens, a caller has a follow-up question. Is there any treatment for floaters?
Yeah, there is. However, what I tell patients is the vast majority of floaters patients are going to get used to. So just like Dr. Aponte was talking about, all of our procedures have a little bit of risk, not high risk, but it's not zero. And so the two procedures that I discuss with patients that you could potentially get rid of floaters are, one would be called vitreolysis, which is a laser, different laser than we've been talking about with the glaucoma stuff, on the same platform sometimes, but different laser where we basically will try to break up the floaters, potentially vaporizing some of the structures there and relieving some of the symptoms. And if that doesn't work, or if patients are still really symptomatic, you can do a vitrectomy, which is basically a surgery that we go in and we remove the vitreous that's causing the floaters. But again, I'll usually counsel my patients to, if you just had started getting the floaters, I would counsel them, wait at least about 6 months, see how you do before we go, because the large majority of floaters patients adapt to and get used to them.
Thank you. Dr. Aponte, I think this caller is asking a question about the physical exam, and they were told that the puff of air is related to eye pressure. What's going on there?
Yeah, so there are different ways to check the eye pressures. Sometimes for the clinics, they can use for the puff of air. Most places do not use that. For nowadays, they can use for the Goldman to actually check the eye pressure, or the Vera, but it is just a way to check the eye pressure. It's a good way to screen, and it doesn't involve the use of eye drops, which is nice for the patients who are going to get some eye exam for eyeglasses.
Thank you. Dr. Graham, a caller was recently diagnosed with diabetes. How does diabetes affect one's eyes, and how?
Diabetes can affect the eyes in a lot of ways. The thing that we fear the most is the effects it can have on the circulation in the eyes. It can weaken the blood vessels, cause them to be leaky. Then I'm talking mainly about the retinal vessels in the back of the eye, cause them to be leaky, which can influence the vision. Even just a high or a low sugar can affect your vision. It can actually change your glasses prescription. So diabetics should be aware that if their sugar is high or low, or if their vision is changing, they should probably check their sugar. And they definitely should have a good eye exam every year, a dilated eye exam, to look for changes in the retina.
Thank you. Dr. Ahrens, this caller wants to know about blue light glasses, and do they work?
That's a really popular question that's going on. So there's some evidence, and kind of depending on who you talk to, what studies you look at, that blue light, especially with all of our devices that we have right now, may be affecting the retina, and specifically the retina cells, and could it potentially be increasing the risk of macular degeneration? I think the 100% decision on that is still out. I think I've talked to some retina specialists who use blue light glasses. I've had others who say, hey, I don't necessarily believe in it. I don't think we'll really know until, kind of farther down the road, when all, us that are using the devices for a long time will kind of know. I don't think it hurts using the blue glasses. You probably have a little bit of a reduction in color quality and clarity, but it's certainly not going to hurt you to use those glasses.
Thank you. Dr. Aponte, is there any truth to the speculation that glasses make vision worse?
Well, for kids, if they have the wrong power for their eyeglasses, then it can make the vision worse because the brain is still being formed. For older people, our brain is, for the most part, formed, and so it doesn't really make a difference.
Okay, very good, thank you. Dr. Graham, are there things that people can do to protect their vision, say, on a daily basis?
Sure, yeah. A good, healthy lifestyle, so good nutrition, I think a heart-healthy diet, high in antioxidants and just a variety of fruits and vegetables that are have the nutrients that your whole body really needs is a good plan. Regular exercise, as Dr. Aponte said, is good for your heart, your circulation, which in turn is good for your eyes. I think that's the basics.
Well, thank you very much. And I want to thank our panelists, Dr. Charlie Ahrens, Dr. Elizabeth Aponte, and Dr. Lisa Graham, and our medical student volunteers, Nathan Johnson, Ethan Lorson, and Danielle Santos. Next week, please join Dr. Mary Owen for a program on cancer prevention, diagnosis, and treatment, when her panelists will be Dr. Matthew Braithwaite, Dr. Roberto Fernandez, and Dr. Jonathan Sandy. Thank you for watching. Good night.